But Milan, I'm going to pass over to you to take over moderation. I saw you 2 days ago in Barcelona. You represent ELPA, the European Liver Patients Association, as a vice president. You represent them at many projects, and you were here for the Liver Aim Steering Committee. I think you were flying to Brussels for a policy meeting on NCDs and liver health in the Parliament today. I don't know if you're still there, but thank you for joining us from wherever you are, and thank you for all the tireless work traveling around, engaging in your home country and other countries on behalf of liver health from biohepatitis, now more to MASLD and MASH. So over to you to take us through to about 25 after the hour. Thank you.
Thank you so much, Jeff. Really, it's an honor to be among you. Really was a lot of travels these days. I will, for the warm words, was so nice to hear that we are involved in so many different activities together with all of you guys here who are wonderful speakers and scientists and patient advocates who are representing this liver community and this unique voice. Today, really, it's a pleasure, and I like to thanks to Michael Battelle and Fatty Liver Alliance inviting me and giving me a chance to be a moderator with these wonderful two advocates who has really excellent experience in the liver field. Really, today, it's I'd like to welcome you to the session, the patient voice, muscle mesh real world experience. And why today we are here? This is very important question, I will say, because I will say somehow behind every guideline, every biomarker which was mentioned and every clinical decision, I think it's we need to be open and to say that it's a human story. And too often these stories remain somehow unheard in liver disease, especially if we go in the field of MASLD and MASH. The patient is not just available voice, but is essential, I will say, to improve the early detection, to reduce the stigma who exists, and to shaping different care pathways that truly work in the real life. Really, today it's my honor to present two brilliant advocates, I will say, José and Una, who are bringing a deep experience from the patient communities and their personal journey in advocacy. I will not keep going deeply in the discussion why the patient voice is so important. I will give the floor to one of my dear colleagues and advocates, José, to start and to emphasize why this patient voice is so important to be included on every different levels of decision making. This is very important, and I will give you the floor, you.
Okay, thank you so much, and thank you, organization, for the invitation. I will give just briefly start and then hand over to Una. Well, as we always say as patient advocates, it's with us and not about us. So that's why we always dare to talk about what's bothering us and what's important for us. And now I want to hand over to Una.
Yeah, I suppose it's a partnership between the clinicians and the patients is more important now than ever. And I think we saw that during the COVID pandemic. And we have to appreciate that there's a lot of misinformation in all aspects of where we get our fact finding. But particularly in the medical field, the medical misinformation is only increasing. So the combination of physicians and primary care and patients coming together adds credibility to all, because when you're researching about a disease and you're frantically trying to get that information, it's very important that you can reference to somewhere that you can go to where you're actually getting the fact finding that's a combination of clinicians and patients. And I suppose as the previous speakers have said, with the language change, it's very hard for people to understand with MASH, where if they have this diagnosis. And I always find that, when you're talking to someone and they have a new diagnosis and it starts with, what they had for breakfast that morning, and then they went to the doctor and they did this test, and there's a big story, maybe more so in Ireland because we like telling stories. But when you're talking about this particular cohort, it's often a very quiet landing diagnosis. So people sometimes, and patients, like, we don't understand the significance that this has in our lives. Do you know, at that very and then there isn't this big conversation among families, and we all know with this condition that there's a huge genetic and familial area. So I think, it's just to try and educate us as the advocates, us as patients, and likewise educating back to the primary care physicians, even like the language. And I know a lot of people have talked about this, but there's such a fatigue in terms of lifestyle advice. Like, we get it all the time, and it's very important, but framing it maybe in terms of like, what have you done in the past that hasn't worked for you? What did you find work for you? And then that just opens up the conversation. I think primary care is such you really learn to get to know your the people delivering the care to you, and you disclose more and you would hear more, I find, with your primary care than others. So I might pass back to José just on comments on that.
Mhm. Yeah, well, you're completely right about, well, it's a silent group. People, because there's a stigma, people felt judged, they are ashamed. And to go to the primary care physician is always a big step for people. And that's also, there are a lot of barriers for people to speak out, especially when they are obese and they are in shock about their diagnosis, and they know, oh, my obesity plays a very big role. And then is there the whole, well, all the people around them, because everybody has an opinion about you. And people are, well, very scared to talk about that. And there are so many barriers that we have to break through to make it more accessible to people to talk about. And we, as patient advocates, we give already a lot of advices to physicians about, well, ask, what did you try already? What works for you? Because everybody is different. We have people who stay the whole day at home, or, well, younger and older, or have to go to work, travel a lot or not. There are all different situations. So there's not one size fits for all. And
Thank you, José. I think you mentioned very important things about the stigma. Also, I can add here the confusion and the fear of the patient. This is very important moments which usually sometimes is not coming on the table, and how the role of the primary care physicians should play this transformative role, especially in the process where need the support. This is very important step, and also the support of early detection. I think we have a really amazing innovation who are coming on the table, and this transformative role which the primary care physician need to fill in the next couple of years, how to deal it with the gaps and the challenges and barriers together with us on the ground, which we call boots on the ground, where we're facing with the realities. I think with our long-term experience and know-how skills which already exist among the patient communities, we can contribute on different ways how to, let's say, avoid these barriers and challenges. Also, I will add on this why the patient role is also important, not just in the primary care, but in the mediation of the process, how to get the attention with the much bigger, higher level between scientific hepatology community and the primary care physician. Because not to forget that we are speaking for an organ, liver, which is somehow a multi-sectoral organ who is connected with a lot of other factors of comorbidities. And that's giving us a lot of, let's say, opportunities how to address all of unlimited needs which are facing our real patient on the ground. And in the same time, how to...
I think that we all know that, and we know about how important the organ is, and that we are talking about the liver, and well, we are very dedicated to the liver. But I think the general population is not aware about the role of their liver. They are confronted with very often a disease, with or their obesity, which is a chronic disease as well. And I think that our role is just to advise also healthcare professionals to do it different, to ask different questions. Language is so important. That's why I'm so happy with the whole language theme we have in the liver world. And I think that healthcare professionals don't realize when a patient comes to them for help, how many times they try to lose weight already. At least 10 times. At least they lost 25 kilos, but they gained 35. And it's very difficult to talk with doctors about that, or other healthcare professionals, dietitians, well, physiotherapists and other healthcare professionals who are involved. And that's something that when they start to realize, like, hey, this patient is coming for help, and don't say, yeah, you have to do more exercise or lose weight, because that's no news for people with obesity, especially not for people with a liver disease, because they know that they ask for support, they ask for help. And that is always my main message. So ask, and Una started with that, ask, what have you done already? Probably that didn't help, because otherwise you were not here. So how can we help? And that's so important. And always we have in mind that how important the liver is, and how that we have to take care for your liver. But those patients have to learn that. And so there's a lot of education needed, and we all know that. But I think that a lot starts with, well, the language. And that's so important.
Thank you very, very much, Jose, for you raise a very important issue, I will say, and challenge for the future, which already somehow in Europe we started to addressing together with the scientific community and European Liver Patient Association. And this is an excellent example when you mentioned that at the moment we have different possibilities from the other parts of the world, where we have this public-private partnership with the European authorities and the research community on different levels, which are bringing this, let's say, research projects like LiverAim, which I was 2 days ago in Barcelona, which bringing a lot of hope for us, like patient communities. What's mean for us these different levels? That mean we need to act from the local to every kind of level, national, regional, European, or global level. But I'm so proud that we are part of this LiverAim and LiverScreen project, which are ongoing at the moment. One of them is finishing, it's coming with great results. And I'm very interested and keen what ELPA last year did it at Amsterdam, how we did it this on the ground with our hepatology community in Europe. It is that we go outreach programs, which we did it to make a total different approach, how to inform the people, the general population, that something is happening and can be connected with the liver. And this can be very easy, let's say, screen it or get the information about your liver. And I think what ELPA did it, ELPA did it, also LiverScreen project doing. We did it in front of European Parliament 3 years ago by row, under the patronage. We're trying what to do, what's mean the patient voice for us there, among the policy decision makers, among the scientific populations, among the general populations, among the other medical, let's say, scientific societies, and our, let's say, indirect partners, which we need to be together in this work. And I think we open the space where we have enormous possibilities to elevate the awareness about the liver. And I'm so grateful today that we mentioned all of these things, because really somehow next year, with a lot of innovation which is coming on the table, I think Europe and many of the Western countries like USA, Canada, Australia, and some other parts of the world has unique opportunity how to reshape the future of the liver communities. But
Yes.
in the synergy, bridging the gaps with the other communities, like you mentioned, obesity, cardiovascular things, and many of the other, let's say, comorbidities who are interconnected between them. And we're happy that after 2 weeks in Europe, we will get the cardiovascular plan, which we make so many interventions with our scientific communities. I'm so grateful about that, where we're trying to make another option for the liver community, which can bring a lot of options where scientific communities together with these public-private partnerships open on a bigger scale discussion for elevating the problem, especially with MASH and MASLD. And through this international experience, which I'm so grateful to Michael, which is bringing today with all of these amazing speakers and amazing audience, which we have it today among us. I think really we are not aware what kind of challenges which can bridge the next, especially in the next 2 years. And this is really a good option for all of us, how to give a fingerprint on something which is coming. And this is
And
something
just
which
Milan, sorry, on that, I know you talked about, just the bringing up like kind of to get liver on a higher benchmark. And I was at a meeting lately, and one of the advocates said, we don't have a liver emoji. And with all the different languages around Europe, the heart have the emoji, the audiologists have the ear emoji, the neurologists have the brain emoji, the cardiology have theirs. Even there's one for that's like the blood, for the hematologist. But liver is way down on that. And I think primary care have a really unique opportunity to bring up, like they do breast screening, colorectal screening, all these screening. And I appreciate that it's like every good idea that comes up in society is always told, oh, we need to teach children that in school. And the teachers are going mad saying, I have enough to teach without adding to that. And I totally appreciate that primary care have so many things on their plate. But I think if we really start bringing in the conversation around liver health, and it's something that starts, really from, even when you're going in with your children and you're asking the parents, that are getting their children vaccinated, and have you had your breast screening, and how is your liver health? And I think really just starting that conversation will bring about the change. And then if we get the liver emoji, the hepatologists will be in the gang as well. But I think there's definitely a point in time now where we can really just start having those conversations and really bring in the liver health as, I would say the dermatologists don't like it, but the liver is the biggest organ, and the dermatologists say no, the skin is the biggest organ. But it's a really big organ, and it has such low visibility in our healthcare system. And I think with the primary care physicians coming along with this, we can definitely change that.
I agree with you totally,
And,
but
and
not
I want to add to Una that we must never forget that, of course, we are speaking to the liver because that's our organ, but people are more than their liver. And that's
definitely I
something
agree
that a lot of doctors forgot.
with both of you, but we not to forget that to have all of what we like and to be recognized from the primary physicians, it's very important what at the moment at the European level are ongoing these initiatives, through these European initiatives where it's liver aim and everybody who are struggling to bring what accessible, affordable tools, biomarkers, which need to be very practical and useful, how to be adapted to the primary care. This is, I think, one of the most first steps which we can do much more. At the moment has a lot of things, like we listened, Luisa and Jeff, about the biomarkers and about the specificity and all of these things. We need to have on our mind that everything what is happening, it's happening with the reason of simplicity. And that means that need to be somehow adapted for the primary care. And that's mean to be visible, accessible, and affordable on that package, which can be not so, let's say, because everybody are talking on this primary care, but we need to find the easiest way how to do it. And I see we have a lot of discussion with them on the European level. They have very big interested, but we need to adapt in all of these, let's say, ways. And I'm so grateful today because Jeff is here, and we heard many news in Barcelona. I'm so happy that probably in the next period is coming greater news from their sides about this, let's say, amazing project about liver screen, which it's one of the steps in the primary care, if you like, what you mentioned with the other diseases like colorectal cancer, or I don't know what kind of other screening exists at the moment, breast cancer or everything, but what you're mentioning. But also we need to have in mind that we are speaking for chronic liver diseases. That's mean a package of diseases. This is something a little bit different, with a different approach. But really, I agree with everything what was said. Today, we have unique opportunity to discuss and to give a little bit feedback to our scientific and academia in hepatology who are listening us like a patient advocates who are seeing all of these different perspectives from the patient side. I like to say that if we don't have something else to add, especially in the
Just
field of
one
the
question in I just noticed there, Milan. It's like to the patient representatives, what lifestyle interventions do you find practical? And then is there enough support for the lifestyle changes at primary care level in your countries? José, do you want to speak maybe on the
Can you
I cannot
explain?
or those.
Yeah, well, I think you have to look in your own country. What are the possibilities? What is the culture in your own country, and see what the possibilities are there. Because in Europe we have so many countries with, well, I think the United Nations has acknowledged 44, but we have 44 different cultures. And I think all the patient advocates have to look for what are the possibilities here, where can we have the most benefit of what is going right and what is not going right in our countries. So I think that's a big challenge for everyone. And but step by step, we will manage to make the care better. But also, I think that healthcare professionals need to, maybe they have to understand that we will help them as patient advocates in this journey. And that, as I always say, we bring all of us has one ingredient of the pie, and the pie will always only be successful if we can bring every ingredient there's needed.
Thank you very much, Jose, for the answer. I know that it's a lot of questions for the patient probably, but I don't like to keep the timing. I will give the floor to Jeff to continue with this wonderful summit which started today, and with the conclusions which are coming from the other panelists. It was a pleasure for me to have this presence today, and I hope so that in near time we will have also something face-to-face which can bring also another perspective. Thank you very much.
Thank you very much, Milan. Thank you, as always, José and Una, for your unique perspective from the patient advocacy organizations.